Step 1. Remove any form of jewelry and accessories from your forearms. Make sure any neck jewelry is contained in your surgical attire scrubs as well. Step 2. Inspect your skin and nails. Make sure that your nails are free from cuts or any wounds, and nails must not extend past your fingertips. Step 3. Don proper PPE such as eye protection and a surgical mask covering your nose and mouth. Step 0. Wet hands with water. Step 1. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Step 3. Rub palm over left torso with interlaced fingers and vice versa. Step 4. Palm to palm with fingers interlaced. Step 5. Back of fingers to opposing palms with fingers interlocked. Step 6. Rotational rubbing of left thumb clasp in the right palm and vice versa. Step 7. Rotational rubbing backwards and forwards with clasped fingers of right hand and left palm and vice versa. Step 8. Rinse hands with water. Step 9. Dry thoroughly with a single-use towel. Use towel to turn off the faucet. Your hands are now safe. Next, we have surgical hand washing. Step 1. Repeat the same proper hand washing procedure as mentioned earlier. Step 2. Use a disposable nail pick to clean under your fingernails under running water. Dispose of the nail pick in the trash bin and rinse hands and forearms. Once the hands and arms have been washed, remove the sterile surgical sponge from its wrapper and moisten the sponge under running water by squeezing and releasing it. Step 5. With fingertips together, use a light, firm pressure to stroke the nails in a back and forth motion with the abrasive brush side of the sponge approximately 30 times. Next, turn the surgical sponge over to the non-abrasive side. Place fingers side by side, including the thumb, and scrub the surface of the palm 10 strokes. Then, turn the hand over and scrub the dorsal surface 10 strokes. Next, scrub the outside surface of the thumb from wrist to tip of the thumb 10 strokes. Continue to apply 10 strokes to the other side of the thumb to each side of your fingers. Once you scrub an area, do not go back. Now that you've scrubbed your hand, it's time to scrub your arm on the same side. Mentally divide the forearm into thirds from wrist up to 2 inches above the elbow. When scrubbing each third of your forearm, apply 10 strokes to top, bottom, and both sides of each section. Like before, once you scrub an area, do not go back. Repeat the scrub on the other hand and arm. Once both arms and hands are complete, discard the surgical sponge inside the trash bin. Start rinsing at your fingertips and continue to the hand, forearm, and elbow, moving in one forward direction through the water. Always keep your elbow at the right angle and hand raised above the level of your elbow. Do not move arms back and forth in the water. If you need additional rinsing, completely remove your arm from the water stream and re-rinse it at the fingertips until you reach the elbow. Thank you.